In a world increasingly connected, the threat of a pandemic looms large, but preparedness can be our strongest defense.
Good morning, everyone. Today, we'll discuss the critical steps necessary to prepare for future pandemics. It's not a matter of if, but when.
History offers stark reminders of the devastation pandemics can unleash. Understanding past outbreaks is crucial to shaping our future strategies. Early detection is paramount. Cutting-edge research and robust surveillance systems are our first line of defense.
The key is rapid identification and characterization of novel pathogens. This allows for the development of targeted diagnostics and potential treatments.
Effective communication and coordinated response are essential to contain the spread of a pandemic. This requires collaboration across all levels of government and society.
We need real-time data on infection rates and resource availability. The public needs clear, consistent information. We also need to address misinformation and build public trust. Transparency is key.
Individual responsibility plays a vital role. Simple measures like hand washing, mask wearing, and vaccination can significantly reduce transmission. Investing in research and development is crucial for creating effective vaccines and treatments. Speed and scalability are paramount.
Our goal is to develop broadly protective vaccines that can rapidly adapt to emerging variants. This requires global collaboration and data sharing.
A resilient healthcare system is essential to handle surges in patient demand during a pandemic. This requires adequate staffing, supplies, and infrastructure.
We need to ensure that all patients have access to the care they need, regardless of their socioeconomic status.
Pandemic preparedness is a global challenge that requires international cooperation. Sharing data, resources, and expertise is crucial for protecting everyone.
We must strengthen global surveillance networks and improve our ability to detect and respond to outbreaks anywhere in the world. We also need to address health inequities and ensure that all countries have access to the resources they need to prepare for and respond to pandemics.
Education is key to empowering individuals to protect themselves and their communities. By teaching future generations about pandemic preparedness, we can build a more resilient society.
Remember, staying informed and taking simple precautions can make a big difference in protecting yourselves and others.
Pandemic preparedness is not just the responsibility of governments and healthcare professionals. It's a shared responsibility that requires the active participation of every individual and community.
By working together, we can build a world that.
Anna has been feeling unwell for a week, battling a persistent cough and fatigue. She's hoping Dr. Lee can provide a quick fix.
I just can't seem to shake this, doctor. I need to get back to work. Is there an antibiotic you can prescribe?
Let's take a look, Anna. Dr. Lee examines Anna. It seems like a viral infection. Antibiotics won't help with that.
But I always feel better after taking antibiotics.
I understand your frustration, but using antibiotics when they're not needed can lead to antibiotic resistance. It's a serious problem.
Bacteria are constantly evolving. When exposed to antibiotics, the weaker ones die, but the stronger ones survive. These survivors multiply, creating a population of bacteria resistant to that antibiotic. Mr. Jones contracted a common infection after surgery, but this time the usual antibiotics aren't working.
We've run several tests. The infection is resistant to multiple antibiotics. It's quite serious.
What does that mean, doctor? Am I going to be all right?
We're doing everything we can, Mr. Jones. We're trying to find an alternative treatment. It will take time.
The overuse and misuse of antibiotics are major contributors to resistance. In agriculture, antibiotics are often used to promote growth in livestock. In some countries, they are readily available without a prescription, leading to unnecessary use.
So what can we do? First, only take antibiotics when prescribed by a doctor, and exactly as prescribed. Don't share them with others or save them for later.
That makes sense. What else?
Practice good hygiene. Wash your hands frequently, cover your mouth when you cough or sneeze, and stay home when you're sick. Prevention is key.
Simple steps can make a big difference. Washing your hands effectively removes germs. Covering your cough prevents the spread of infection, and staying home when sick protects others. Scientists are working tirelessly to develop new antibiotics and alternative treatments, but research takes time and resources.
The challenge is immense, but we are making progress. Understanding how bacteria develop resistance is crucial to finding new solutions.
Thank you, doctor. I understand now. I'll focus on rest and symptom relief.
That's great, Anna. Remember, we all have a role to play in fighting antibiotic resistance. By using antibiotics responsibly, we can protect ourselves and future generations.
Antibiotic resistance is a global threat, but by working together, we can slow its spread. Informed choices, responsible use, and continued research are our best defenses. Anna is a working mother, struggling to balance her job and family responsibilities.
Dr. Lee, I've been having these headaches for weeks. I just don't have time to deal with this right now.
I understand, Anna. Let's figure out what's going on. Do you have health insurance?
Yes, but my deductible is so high, I'm not sure I can afford all the tests you might want to run.
The narrator explains that many Americans face challenges in accessing healthcare due to high costs, even with insurance. David is a senior citizen on a fixed income.
Maria, my Medicare only covers so much. I need physical therapy, but I can't afford the copays.
David, we have a sliding scale fee program here. Based on your income, you may qualify for reduced costs.
Maria explains that community health clinics offer vital services to underserved populations, often providing care on a sliding scale based on income. Sarah lives in a rural area with limited access to medical facilities. I don't know what I would do without this mobile clinic. The nearest hospital is hours away.
We're here to help, Sarah. We offer basic checkups, vaccinations, and can connect you with specialists if needed.
The narrator highlights the importance of mobile health clinics in reaching isolated communities, providing essential healthcare services. Josh is uninsured and experiencing severe abdominal pain.
Groaning. I've been here for hours. I don't even know how I'm gonna pay for this.
The narrator discusses the Emergency Medical Treatment and Labor Act, EMTALA, which requires hospitals to provide emergency care regardless of a patient's ability to pay. The narrator highlights the strain that uninsured patients place on the healthcare system. Policymakers are debating potential solutions to improve healthcare accessibility. We need to expand Medicaid to cover more low-income individuals. We should incentivize hospitals to lower their costs and improve efficiency. Investing in preventative care is crucial to reduce long-term healthcare expenses. The narrator explains various policy options, such as expanding insurance coverage, controlling healthcare costs, and promoting preventative care. Weeks later, Anna utilizes telehealth services for a follow-up appointment.
Anna, your test results came back, and everything looks normal. The headaches might be stress-related. Let's explore some stress management techniques.
Thank you, Dr. Lee. This telehealth appointment saved me so much time and money.
The narrator emphasizes the role of telehealth in improving access to care, especially for those with time constraints or mobility issues. Maria is conducting an outreach program to educate people about their healthcare options. Today, we delve into the critical world of public health policies. These policies are the bedrock of a healthy society, influencing everything from disease prevention to access to healthcare.
Public health policies are essentially the rules, regulations, and laws designed to improve the health and well-being of populations. They are proactive measures aiming to prevent health problems before they arise and address inequalities in health outcomes.
These policies touch upon diverse areas. Vaccination programs protect against infectious diseases. Regulations on smoking and alcohol consumption aim to reduce chronic illnesses. Food safety standards ensure a healthy diet.
The latest data shows a significant rise in childhood obesity, particularly in underserved communities. We need to address this urgently.
I agree. Perhaps we could propose a policy that incentivizes healthier food options in schools and subsidizes access to recreational programs.
Policymakers play a crucial role in shaping public health. They analyze data, identify health challenges, and propose evidence-based solutions.
Maria, it's important to manage your blood sugar levels. The city offers free diabetes education classes at the community centre. I highly recommend you attend.
Thank you, doctor. I didn't know about those classes. I'll definitely look into them.
Effective public health policies rely on community involvement. Healthcare providers, community leaders, and individuals must work together to implement and sustain these initiatives.
The preliminary results are promising. The new program shows a higher success rate in helping people quit smoking compared to traditional methods.
Research is the backbone of effective public health policy. It provides the evidence needed to design and evaluate interventions.
This tax will disproportionately affect low-income families. They rely on these affordable options.
But the health costs associated with sugary drinks are enormous. This tax could incentivize healthier choices and generate revenue for health programs. Public health policy is often a subject of debate. It requires balancing individual liberties with the collective good. Investing in public health policies has far-reaching benefits. It improves health outcomes, reduces healthcare costs, and enhances the overall quality of life.
In conclusion, public health policies are essential for creating a healthier and more equitable society. They are a continuous process of assessment, planning, implementation, and evaluation.
Understanding public health policies is everyone's responsibility. By engaging in discussions, advocating for change, and making informed decisions, we can all contribute to a healthier future. Welcome to this comprehensive guide on yoga and relaxation techniques. In this video, we'll explore various practices to help you reduce stress, improve flexibility, and enhance your overall well-being. First, let's begin with basic breathing exercises. These techniques can be practiced anywhere, anytime, to calm your mind and body.
Okay, let's start with deep belly breathing. Place one hand on your chest and the other on your abdomen.
Anna demonstrates the technique, inhaling deeply through her nose, allowing her abdomen to rise, and then exhaling slowly through her mouth, feeling her abdomen fall.
Inhale deeply, feeling your belly expand, and exhale slowly, releasing all the tension.
Next, we'll move on to alternate nostril breathing. This technique helps to balance the nervous system.
Close your right nostril with your thumb, inhale through your left nostril. Then, close your left nostril with your ring finger and exhale through your right nostril.
Anna continues the cycle, alternating between nostrils with each breath.
Continue this pattern for several rounds, focusing on the breath. Allow the breath to soothe you.
Now let's explore some basic yoga poses. We'll start with sun salutations, a dynamic sequence to warm up the body.
Inhale, reach your arms overhead. Exhale, fold forward.
Anna moves gracefully through each pose, mountain pose, forward fold, plank pose, and cobra pose.
Remember to listen to your body and modify as needed. Yoga is about self-awareness and self-acceptance.
Next, we'll move into the warrior poses, which build strength and stability.
Step your right foot forward into Warrior One. Arms overhead, gaze forward.
She transitions smoothly to warrior two, opening her hips and extending her arms out to the sides. Finally, she demonstrates warrior three, balancing on one leg with her body parallel to the floor.
Hold each pose for a few breaths, feeling the strength in your legs and core.
Now we'll conclude with Savasana, a deeply relaxing pose.
Lie flat on your back, arms at your sides, palms facing up. Close your eyes and let your body completely relax.
Anna guides viewers through a body scan, focusing on releasing tension in each part of the body, from the toes to the head.
Let go of any thoughts or worries. Just be present in this moment, allowing yourself to rest and rejuvenate.
In addition to yoga postures, visualization can be a powerful relaxation tool. Close your eyes and imagine a peaceful place, engaging all your senses. Another effective technique is progressive muscle relaxation. This involves tensing and then releasing different muscle groups in your body.
Start by clenching your fists tightly for a few seconds, then release. Notice the difference between.
Anna is feeling overwhelmed by work and personal life. She knows she needs help, but isn't sure where to start.
I'm just so stressed all the time. I can't sleep, I'm irritable, and I feel like I'm constantly on edge. It sounds like you're going through a lot, Anna. Therapy can provide you with tools and strategies to manage these feelings.
Dr. Lee explains that there are various types of therapy available. Individual therapy involves one-on-one sessions with a therapist, offering a safe space to explore personal issues. Group therapy provides a supportive environment where individuals share experiences and learn from others facing similar challenges. Online therapy offers convenience and accessibility through virtual sessions with licensed therapists.
Cognitive behavioral therapy, or CBT, focuses on identifying and changing negative thought patterns and behaviors.
A graphic appears on screen illustrating the CBT model. Thoughts, feelings, behaviors.
Dialectical behavior therapy, or DBT, emphasizes emotional regulation and mindfulness skills, particularly helpful for those with intense emotions.
A graphic appears showing DBT skill modules: mindfulness, distress tolerance, emotional regulation, interpersonal effectiveness.
This is all really helpful. I think understanding the different types of therapy makes it less intimidating. Absolutely. It's about finding the right fit for you. We can also explore other options like psychodynamic therapy, which delves into past experiences, or humanistic therapy, which focuses on personal growth and self-acceptance.
Visuals appear showcasing psychodynamic therapy, a person reflecting in a comfortable chair, and humanistic therapy, a person meditating outdoors.
So how do I choose the right therapist? Consider your goals, preferences, and what you're hoping to get out of therapy. Research different therapists and read reviews. Don't be afraid to schedule initial consultations to see if you feel comfortable with their approach.
A graphic appears with tips for choosing a therapist. Check credentials, read reviews, consider your budget, and trust your gut.
I started therapy, and it's actually been really helpful.
That's great, Anna. I've been thinking about it too. I just didn't know where to start.
There are so many options. Finding the right therapist and approach makes a huge difference.
Anna continues her therapy journey, learning new coping mechanisms and gaining a better understanding of herself. Therapy isn't a quick fix, but a journey of self-discovery and growth. With the right support, anyone can improve their mental well-being. Remember, you are not alone. If you're struggling, reach out for help. There are resources available. Mark has just been diagnosed with type 2 diabetes. He's feeling overwhelmed and unsure of what to do next.
Mark, I understand this is a lot to take in, but we're going to work through this together. Managing a chronic condition like diabetes is all about making informed choices and developing a sustainable plan.
But where do I even start? It feels like my whole life has to change.
It doesn't have to be a drastic overnight change. We'll focus on gradual adjustments to your diet, incorporating regular physical activity and monitoring your blood sugar levels. We will discuss a care plan that works for you. It's really important to us that the care plan suits you.
One of the first steps in managing any chronic disease is understanding the role of nutrition. A balanced diet can make a significant difference. Mark started by making small changes, like swapping sugary drinks for water and adding more vegetables to his meals.
Okay, salad for lunch. I'm starting to get used to it.
Physical activity is another key component. Even a short walk each day can have a positive impact.
Hey Mark, good to see you. How are you feeling?
Much better, actually. Getting out here has been a game changer. I feel more energetic and less stressed.
Medication is often a necessary part of managing chronic diseases. It's crucial to understand your medications and take them as prescribed.
It's important to take this medication with food, Mark. And please let me know if you experience any side effects.
I appreciate that. I will.
Living with a chronic condition can be challenging, but you don't have to do it alone. Support groups can provide valuable emotional support and practical advice.
I used to feel so isolated, but being here with all of you, knowing I'm not the only one going through this, has made all the difference.
We're all in this together.
Regular monitoring is essential to track progress and make necessary adjustments to the treatment plan.
Mark, your numbers have improved significantly. All your hard work is paying off.
That's great to hear. I feel like I have more control over my health now.
Managing a chronic disease is a journey, not a destination. There will be ups and downs, but with the right tools and support, you can live a full and meaningful life.
What if I start to feel overwhelmed again? Or if my numbers start to get worse?
That's okay. Managing a chronic condition isn't always linear. There will be times when things get tough, and that's normal. The important thing is to not give up and to reach out for support when you need it.
Chronic disease management is about empowering yourself with knowledge, building a strong support system, and taking proactive steps to improve your health and well-being. Meet Sarah, a smart, creative girl, but school can be a real challenge for her.
Ugh, numbers. Honey, are you having trouble? It's just hard, Mom. I can't make my brain do it.
Anna noticed a pattern of difficulty. Sarah seemed bright, but consistently struggled with certain tasks. Reading was also becoming a sore point.
So, Anna, you've observed some difficulties with focus and reading.
Yes, it's more than just typical kid distractions, Doctor. She really struggles, and it's affecting her confidence.
It's good you brought this up. We should consider the possibility of ADHD or a learning disability like dyslexia. There are assessments we can do.
Dr. Lee recommended a comprehensive evaluation. The evaluation involved various cognitive and academic tests to pinpoint Sarah's strengths and weaknesses.
To Sarah. You're doing great, Sarah. Just a few more questions. The results indicate that Sarah has ADHD and dyslexia.
ADHD and dyslexia? What does that mean for her future?
It means we can develop a tailored plan to support her. With the right strategies and interventions, Sarah can thrive. It's all about understanding how her brain works and adapting our approach.
Dr. Lee explained that ADHD, or attention deficit hyperactivity disorder, affects attention, impulse control, and activity levels. Dyslexia, on the other hand, is a learning disability that primarily affects reading and language skills.
Okay, Sarah. Let's try breaking this word into its sounds. Sat.
Cat!
With targeted support, Sarah began to make progress. Mr. Jones uses specific strategies to help her with reading. At home, Anna reinforces the skills Sarah is learning at school. Assistive technology plays a crucial role.
You're doing so well, sweetie. Keep going. To be or not to be? That is the question.
With the right support and understanding, Sarah not only overcomes her challenges, but also shines. Early identification and appropriate interventions make a world of difference.
Try sounding it out like Mr. Jones taught us. It really helps.
Sarah becomes an advocate for herself and other students. Remember, ADHD and learning disabilities are not limitations. They are different ways of learning and thinking. With understanding, support, and the right strategies, every child can reach their full potential. Sarah, you did amazing in the play.
Thanks. It was so fun. I couldn't have done it without Mr. Jones and my mom helping me.
You're like a superhero, Sarah, helping us and being a star on stage.
Nah, I just learned how to use my superpowers. You all can too. As parents and educators, our role is crucial in recognizing the signs early and implementing supportive strategies.
How did you stay motivated through it all, Anna? Sarah and Mark brought Ben in today because they noticed he wasn't developing quite like other children his age.
Based on our observations and the assessments, Ben shows several characteristics consistent with autism spectrum disorder, or ASD.
Autism? But he's so bright. He knows all his letters and numbers?
That's not uncommon, Sarah. ASD is a spectrum. It affects individuals differently. Strengths in some areas don't negate challenges in others.
Dr. Amara gestures gently, explaining the spectrum of autism to Ben's parents. At school, Ben faces different challenges. Social interaction can be difficult for him, and changes in routine are unsettling.
Ben, can you draw a circle like this?
No, I want to draw cars.
Ben throws his crayon down and covers his ears. Miss Jenkins approaches him calmly.
It's okay, Ben. How about we draw a car inside a circle?
Back home, Sarah and Mark are researching autism spectrum disorder, trying to understand what it means for Ben and their family.
It says here that early intervention is really important.
I saw a program that focuses on social skills. Maybe that would help Ben connect with other kids.
They both watch Ben, realizing they need to be the best advocate for their son. With the support of therapists and educators, Ben begins to learn strategies for navigating the world around him.
Okay, Ben, let's practice saying hello. Can you say, "Hi, my name is Ben"?
Hi, my name is Ben.
Great. Now what do you do after you say hello?
Smile?
Exactly. A big, friendly smile.
Anna claps. Ben shows a small, shy smile. It takes time, but slowly, Ben begins to connect with his peers. Hi, what are you doing?
Lining up rocks.
Can I help?
Okay.
Lily begins to line up rocks with Ben. They are working together now. Ben discovers his passions and talents. He finds joy and fulfillment in his unique way of experiencing the world. Years pass. Ben has grown and learned so much. He's still Ben, but he is more confident and self-aware.
And the Tyrannosaurus Rex had the strongest bite force of any land animal. Can you imagine how powerful that was?
That's incredible, Ben. You really know your dinosaurs.
He does. He can name them all.
Sarah and Mark smile, their hearts filled with love and hope for Ben's future. They know the challenges may continue, but they will face them together. Autism spectrum disorder is a part of who Ben is, but it doesn't define him. He is a son, a brother, a friend, and an individual with unique gifts to share with the world. By understanding and accepting individuals with autism spectrum disorder, we can create a more inclusive and supportive world for everyone. Anna has been experiencing persistent allergy symptoms and has come to Dr. Lee for answers.
I'm just so tired of feeling this way, Dr. Lee. Constant sneezing, itchy eyes, a runny nose. It's impacting my daily life.
I understand, Anna. Let's discuss allergy management. The first step is identifying your specific allergens. We'll perform some tests.
Dr. Lee's nurse administers a skin prick test, exposing Anna to small amounts of common allergens. After 20 minutes, the results are in. Dr. Lee examines Anna's skin.
Okay, Anna, it looks like you're allergic to dust mites, pollen, and pet dander.
So, what do I do now? I can't exactly live in a bubble.
That's where allergy management comes in. It's a multifaceted approach. First, avoidance. Minimize your exposure to those allergens.
Dr. Lee begins to explain avoidance strategies. This includes things like frequent cleaning, using allergen-proof bedding, and keeping pets out of the bedroom. Anna takes control of her environment, diligently cleaning and making changes to reduce allergens in her home.
In addition to avoidance, we can use medications to manage your symptoms. Antihistamines, nasal corticosteroids, and decongestants can all be helpful.
Are there any side effects?
Some medications can cause drowsiness, so it's important to discuss any concerns with me. We'll find the right regimen for you.
Anna starts her medication, carefully following Dr. Lee's instructions. However, even with avoidance and medication, allergies can still flare up. Dr. Lee recommends allergy immunotherapy, or allergy shots. Allergy shots work by gradually exposing your body to increasing doses of allergens, helping you build up immunity over time. It's a long-term commitment, but it can significantly reduce your allergy symptoms.
How are you feeling, Anna?
Much better. The allergy shots seem to be making a difference. I'm not sneezing as much, and my eyes aren't as itchy.
That's great news. It's important to remember that allergy management is an ongoing process. You may need to adjust your treatment plan from time to time.
By understanding her allergies and implementing an effective management plan, Anna is able to live a full and active life, free from the constant burden of allergy symptoms.
The key is to be proactive and work closely with your doctor. Don't let allergies control your life.
With proper diagnosis and management, you too can take control of your allergies and enjoy a better quality of life.